I am Bhik Kotecha and I'm an ear, nose and throat consultant surgeon. I have been a consultant since 1995 and my NHS base is at the Royal National Throat, Nose and Ear Hospital in central London and Queen's University Hospital in Romford in Essex. I practice privately both in Essex and London. My expertise covers all diseases of the ear, nose and throat. However, I have a particular interest and specialization in problems of snoring and the condition called obstructive sleep apnea syndrome. Well, sleep apnea is due to a problem with upper airway obstruction, and the obstruction can arise from the beginning of the air entry port, which is the nose, all the way down to the tongue base, hypopharynx and larynx. So usually what I see is a multi-level obstruction of the upper airway where you have bulkiness of the tissues around the throat, the soft palate and the tongue that causes the obstruction in breathing.
About 4 years ago I started to realise that my husband at night time was having interrupted sleep with snoring, and it became so disruptive that I would wake up constantly. I'd wake up to a big deep snore and he would hold his breath and I'd count and I'd wait and it wasn't coming and I'd have to nudge him and then he'd take a big deep breath and start breathing again. So when the diagnosis was finally made and we were recommended to see a chest physician and consult with them about the diagnosis, at that point Jim was offered the sleep apnea mask, which he found very difficult to tolerate. Mr. Kotecha recommended various options for the treatment, one of which was surgery. And that was the route that Jim and I decided to go down. Since the surgery, it is like chalk and cheese. Our life, both our lives, has changed dramatically. Jim is getting an undisturbed night's sleep, and it's a quality of sleep that when I do wake up occasionally, I know it's a restful sleep. The surgery performed by Mr. Kotecha has been, it's changed our lives. That's all I can say about it. And it's amazing.
In order to ascertain whether a patient has or has not got sleep apnea, it is prudent to carry out a sleep study. And usually we carry out what we call an ambulatory home sleep study, but in some cases we may do a hospital-based sleep study. Broadly speaking, the treatment modalities that are available for obstructive sleep apnea are in two categories. One is appliances and the other is surgery. Within the appliances group, we can offer them a mandibular advancement device, which is an appliance quite commonly used by rugby players, boxers, and they use this at night time in order to bring their lower jaw forward and improve their breathing, which improves their snoring and gets rid of the sleep apnea episodes. The NICE guideline recommends that for moderate and severe sleep apnea, we should use what's called nasal CPAP. That stands for continuous positive airway pressure and involves using a device at night time during sleep. Radiofrequency surgery is thought to be minimally invasive. It is less invasive than laser, and essentially it emits heat energy. And this is quite useful in multi-level obstruction, where patients can have radiofrequency treatment to the palate, to the tongue, as well as to the lining of the nose called the turbinates. And so they can have multi-level radiofrequency treatment to improve their upper airway obstruction. And this is quite reserved for patients who have either simple snoring or very mild obstructive sleep apnea. Upper airway obstruction and sleep apnea syndrome does not only affect the adult population, it is very commonly seen in the pediatric population. Quite often the parents come and present these children with this history of the sore throat, but in addition will bring video images of their child suffering at night, hyperextending their head and neck, keeping their mouth open, snoring away and having episodes of breath holding.
The first thing I noticed regarding my son Joe was high temperatures, sore throats, his sleeping pattern was terrible, his snoring, you could hear him snoring from one room to the other. So much time off school mainly. He'd go to bed fine, wake up with such a high temperature, and just having so much time off school that we decided that we needed to look in to see what the problem could be. I decided to go and see a consultant regarding Joe's problems. Mr. Kotecha explained things very well to myself and to Joseph. Not only was he using obviously technical words that needed to be used, he would break it down so that Joseph would understand what was going to be happening, to stop Joe feeling anxious and nervous. Joseph came into the hospital yesterday morning to have his tonsils and adenoids removed. He was in at 7 AM, he was down at theatre by 8. They've been absolutely amazing with him. He's been eating and drinking from the moment he got back from theatre. The staff have been wonderful. They've been in every hour.
Well, I've been a consultant ENT surgeon for more than 2 decades, and I started off in the subspecialization of snoring and obstructive sleep apnea in 1993, in fact. It's been a fascinating journey. At that stage, very little was known about snoring and sleep apnea, and I have dedicated my whole professional life to the understanding of the mechanisms, evaluation, and the treatment modalities available for this condition. I've done a lot of research on this and published and lectured nationally and internationally, and I enjoy the understanding of the whole pathophysiology of the condition, how it has an impact on a social life for patients, and how pleasing and rewarding it is to sort this out for both the patient and the partner.